Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and it's great to be back. Today is May 4th, 2020. This is the first day that the governor has really allowed us to perform elective surgery. And I've been off for about a month, and I've missed my job. I've missed doing surgery. I miss my patients. I miss my staff. It's great to be back. So there's a new normal during this COVID virus situation. And we have a fully accredited surgery center and have for almost 2 decades. And we're mandated to follow very strict safety standards. Where a lot of surgery offices, they're held to office standards, we're really held to hospital type standards. And we have a lot of safety checks, rechecks, inspections, and accreditation is very good for patient safety. So we've always been safe. We've always protected ourselves and our patients because prior to the COVID thing, you had hepatitis C and HIV. So there's a lot of communicable things that can happen during surgery, and we've always been on top of it. So now everybody is really on top of it and new levels of protection. Today I'm going to talk about the Max Air system. And in a couple minutes, I'm going to be in the operating room and I'm going to be wearing this and show you. So it looks like a helmet, and it has these disposable devices here, which is a full face shield, and then the silicone part, and this is disposable, goes under your chin and seals everything off. So this is the disposable part of this. And these systems were developed for the ultimate and safety for the operator and the staff. So it is a face shield, and it also has an air ventilation system going through it. So it doesn't fog up. With this, you don't need a mask because everything is going to be sealed. So you have your eye protection, you have your mask, you're protected from the outside environment, and the patient is totally protected from the surgeon and or the staff. So we're going to show you what it looks like. It's the Max Air system, and they always say that necessity is the mother of invention, and I think that out of the ashes of this crisis, we're going to see some very positive technology that's going to make a difference in patient safety. I am so glad I have 5 facelifts this week because we had to stop for a month and we're catching up. So everybody out there, be safe. We're trying to. I'm Dr. Joe Niamtu, LoveThatFace.com. Okay, so this is the Max Air system. It has a little helmet with it's adjustable for your head size, and then the disposable shield, as we talked about. Now, since I'm breaking sterile technique here, raising my hands, I'm going to re-scrub before we start the case. But I do want to go over a couple things. So there's a battery pack here that I'm wearing that will keep the fresh airflow going for 8 to 12 hours. Now, an N95 mask is a negative pressure. In other words, you're breathing through that mask and it kind of obstructs your breathing. N95 mask is negative pressure. You're kind of breathing against that, and it can, for some people they have a hard time because they have a rough time breathing, and it's 95% effective, hence N95. This is a positive pressure system. So the air is coming in through the back, and I can feel this nice fresh air current that's going across my face. So the shield doesn't fog. I'm wearing loops, and I think it'll take a little bit of adjusting to accommodate loop and or headlight, but this is my first time wearing this. So I'm not tethered to anything. It's just the battery pack that I'm wearing. You can hear the fan going and feel the air coming across your face. So I am totally sealed here from the bottom. I don't need a mask. I don't need goggles. And I think this is going to be total security for the wearer, the surgeon or the staff, and for the patient as well. So I'm kind of excited to see how this works, and we'll be back in a second to show you how we use it. We're going to begin our blepharoplasty here, and we're doing a lower transconjunctival blepharoplasty using the CO2 laser. So one of my situations, I was worried about bending over, if this would be obtrusive, and it really isn't. You can bend in any direction. This is about as far as I can look down before it hits my chest, but I think that this will be a nice innovation, and it is, I think, at this point, the ultimate in protection. So the MaxAir device in this post-COVID world, and I'm Dr. Joe Niamtu, lovethatface.com.